My colleagues are the reason that I come to work every day, in addition to the families that I see and the children that I work with. They are my teammates and my partners in sometimes very difficult and challenging work. When you're working with families of children with disabilities and children with disabilities themselves, it's really critical that you have a strong team. And so my colleagues in the Division of Developmental and Behavioral Pediatrics and at Cincinnati Children's Hospital make the hard work very doable.
What my colleagues or our colleagues mean to us and to me personally, well, it comes back to we call our employees partners. And that's used intentionally because we're all working together as partners to care for people in this ministry. So as any leader itself, you're only as good as the team you have. So the colleagues actually work together to brainstorm how we can care for people better, to elevate our vision and our mission to care for residents.
So colleagues are part of why we get up and come to work every day. So no man is an island, and the Lone Ranger always goes off into the sunset alone at the end. So colleagues are really the antidote to that, and they are there to help you think of new ways to do things and implement things, and everybody's ideas are always better than one person's ideas. So it's how we feel together, and it's how we join together as a team.
The best advice I've ever received is from my dad, Jim Kariakis, aka Papu, which is grandfather in Greek. And he's always told us that it's not the opportunity that you get in life, but it's what you make of that opportunity. And that's advice I live by.
Well, I think, I don't know that it was specific advice, but I guess I learned from watching others that inspiration's important, and that inspiration is the why question, and it's a question that hopefully we keep asking ourselves our whole lives, no matter where you are in your career. Why are you doing what you're doing? And without that, I don't think you can lead people, because they're not going to follow someone who's not inspired.
I think one thing is don't settle for the ordinary, or don't settle for what is status quo. If you know a better way of doing something, go out and do it.
Unlike golf, there are no gimmies. If you play golf, gimmies are the things you get right at the end, but there are no gimmies in life. You got to work really hard for stuff, and if you do, good things happen. And then when mistakes are made, they don't really define us, but what we do with them really defines us.
Crossroad is making a difference in healthcare by, one, providing care for people who would otherwise not have it, and that's critical. We're trying to reduce health disparities in our community in so many different ways.
I and my team members have used innovation to make advances in our field by having to think very creatively about how to serve a very significantly growing number of children with different types of disabilities, specifically autism spectrum disorders, which I specialize in. We've had to think creatively about how to meet the growing demand for services, how to see children in different ways over different time periods with different types of providers, so that every child's need is met and not just the children that cross through our doors.
And people don't always think of this as innovation, but there are many things that have been shown to work elsewhere that aren't done here, and when those are evidence-based practices where it's been shown that they actually work and they make a huge difference, innovation can be as simple as finding ways that fit our culture to do those things here. So we have done a lot of that kind of innovation.
In our field, we are able to seamlessly transmit images to physicians. And with that ability, we have been able to operate MRI centers, and we have 2 non-for-profit women's centers with a 3rd on the way, raising the level of expertise and service in our community.
Well, I think we're making a difference, as I alluded to earlier, because we are inspired by our clients. That's not so difficult to be inspired by healthcare. Some of us have spent a good deal of time within the healthcare environment. I'm married to a healthcare professional. And so you see the good that happens every day, and you see the impact on people's lives, and you want to be part of that. And so it's game on. You want to give your best advice and do your best for the client so that hopefully it has an impact on the hospital and the healthcare organization you're advising.
How my organization is making a difference in healthcare is, I think I'm looking at it from a different approach. I think we live in a world where a lot of things are going on right now where reimbursement is less, and so the natural way to deal with less reimbursement is to see more patients. My goal is to see patients for a longer period of time and do more one-on-one care and do the best care. So I'm kind of looking at it from a different way. I want to give the best care, not through insurances, but just seeing best care for physical therapy for each individual.
Well, innovation is one of our core values, ironically. One of our 4 core values is innovation, and it's mainly because we feel like that there's a need for innovation in the field of aging services. We really have sort of been an overlooked field historically, but as the demographics are aging, there's more older people that we want to really push the innovation. We've tried some different things that haven't worked, and we've tried some things that have worked, and that's really helped advance not only our organization, but the entire field.
The work that we do at Crossroad Health Center has really focused on thinking outside the box and using new ways to provide good health care in a way that brings about health in very challenging situations. A couple of those would include using technology. We've invested heavily into our electronic health records, not just in the expense of the hardware and the software, but how do we use that to bring about change using things like population management, in-office reminders, and a way of really trending what our outcomes are so that we can measure our improvements in real ways.
I think it would be speed. I think I'd want to be fast. And the reason why is sometimes I feel like I'm running around all over the place. And if I can get to someplace quicker to help somebody, I would be doing that. So I'd be Flash Gordon.
Actually, my daughter said this to me the other day, wouldn't it be great, Mom, if we could teleport as we sat in traffic? And that's what it would be. I would teleport myself to different places so that I would never have to waste time in traffic or get frustrated.